Hello and welcome to Biology Explained. Today we're going to be looking at what the coronavirus antibody test does and does not tell us. So, countries are beginning to reopen as coronavirus cases slowly begin to decrease around the world. But in order to have continued measurement of how many cases are going on, we have to continue doing tests. Current tests, which is what most places around the world are currently doing, such as the UK for example, currently take samples from the back of your throat and from your nose. These cell samples are then sequenced in a lab to look for the genome sequence or a specific part of a genome sequence linked to that of the coronavirus. However, these tests can be easily flawed. For example, if they take a bunch of cells that are somehow not infected by the virus where other cells are infected, meaning you'll get no positive result even though you do have the virus, or they are in short supply. I think the UK is now trying to reach a target, or has exceeded a target of 200,000 tests. But obviously that's not enough for everyone in the UK to be tested quickly enough. These tests, such as I just outlined, also cannot detect the virus once the infection is no longer present. Meaning if you want to track how many people have had the virus in the country, and so kind of decide how many people have already had it, whether they're immune, etc., as I'll explain in the rest of the video, that kind of test where they check for the genome, which is the test they're currently carrying out, does not work. However, the other type of test are the coronavirus antibody tests, which is what the government is going to start introducing, and is the test they're probably going to encourage most people in the country to get at some point. And this test basically tells us whether your body has had the virus. And so if you catch the virus, it has certain antigens on it. Your body essentially is able to use T cells, first of all, to recognize the antigens on the surface of this virus, and then over time, B cells and T cells are created which produce antibodies. These antibodies are then allowing your body to respond faster to the virus next time you're infected, essentially. This kind of testing allows us to see whether or not you've been infected. And so essentially what happens is you take a spot of blood and put it into the test. And if your body has been produced antibodies which are match with antigens produced by the virus, which have been created for this test, so if you have those antibodies in your blood, the test will pick them up. And therefore it will tell you whether or not you've been infected previously. However, this leads to a couple of issues about the benefits and disadvantages of such kind of test, which I'll explain now. So for an antibody test to work properly, and for it to be a good indicator of how much of the population has truly caught the virus and is now somewhat protected by their immune system against the virus, we have to ensure that the test actually accurately proves whether or not you have had it or have not had it. And there's always chances with these tests for false positives and false negatives, which is why we don't really want to rush them into production. Common antibody tests usually detect two types of antibodies. One type of antibody is called IgM. Now this is one of the first type of antibodies to appear and be produced by your body after an infection event. However, the IgM antibodies, are less specific than other antibodies produced by your body. And over time, more specific antibodies are produced by your body. But IgM appears first because it's easy to produce and is a good kind of beginner to catch the viruses as they begin and slowly train your body to become more specific and provide a better immune response to the virus. However, over time, the more specific type of antibody that is produced is IgG antibodies, which are produced slower, but are more specific and so bind better with antigens on the virus, and so provide a better immune response. Now, these kind of antibody tests need to be highly sensitive, meaning that they can detect many of these IgM or IgG antibodies. So they need to be sensitive, meaning they can detect a variety of different common coronavirus antibodies, because coronaviruses, especially seeing as there's slight mutations in it, could produce a variety of different antigens. And so you need to make sure the test is sensitive enough that it can detect a variety of these, meaning you're not going to miss any of the common strains or strains of coronavirus and have a false positive or false negative. The test also needs to be highly specific, meaning that they only detect antibodies for the coronavirus. So if the test has too low specificity, it might be able to detect antibodies produced, for example, a common cold, and give a false positive, seeing as the common cold is somewhat related to the coronavirus. And you wouldn't want that, because that means you'd get a whole lot of people testing positive for it when they're not actually positive, so a false positive. However, on the other side, too high a specificity and too low a sensitivity could miss any antibodies altogether and cause a false negative, meaning this person has actually been infected and had the virus, but this test is no longer showing it. I mean, it's a failure, essentially. And so after you've worked out how to get a test that can satisfy all the criteria I just said, the timing of this test is also critical, as too soon after the person has been infected, it will result in too low level of antibody, as your body hasn't produced an accurate or had enough time to produce a response, meaning it will actually maybe give a false test, which you don't really want because you want it to be reliable, when actually this person's been infected by the virus but it's not showing. So timing is also matters. Even if this test that I've just mentioned, the antibody test, does show, say you've had the virus and that you are producing antibodies to the virus, even then it does not actually mean you're necessarily immune to the virus. So these current antibody tests only look for the existence of antibodies. They don't actually look at how effective those antibodies are, or even the number of antibodies in a person, which can vary from person to person depending on what kind of response your immune system is having, how well your immune system response is, etc. So really, we need to be able to use tests to ensure how effective these antibodies are, and ensure there's these effective neutralizing antibodies are in your system. So people could have a variety of different levels of antibodies, different quality of antibodies, and that means that it's hard to really tell whether or not they're going to be truly protected, even though this test says they've had it and they are producing antibodies for it. So more research really needs to be done into that. We also need to work out how long these antibodies last in your body. Having these protective antibodies, which this antibody test can show, doesn't actually necessarily mean you're then immune from reinfection. Now, it is possible once you've had the virus to gain something called sterilizing immunity, where you're completely immune to infection. However, many people will still be able to get reinfected by the virus, but get more mild or few symptoms. However, they might still have the possibility of reinfecting other people, which is not really what we want. So in order to work out how effective having the antibodies are at stopping you getting the infection again and spreading it again, it really needs more testing and monitoring, which is ongoing at the moment, to see how protected a larger subset of the population is from reinfection. Because you need essentially about 80% of the population to be infected with the virus really before herd immunity kicks in and the people who are vulnerable to the virus are protected. This longer-term monitoring is also needed to see how long protective antibodies remain. Because, for example, something for cold antibodies, for the common cold, could last for like a year before they become lost by your body and you need new ones. But antibodies for the SARS virus lasted many, many years. This could either be because your body gets rid of those antibodies or the virus mutates at a relatively rapid pace. And so antibody tests tell us quite a lot. They tell us whether you've been infected, and that can lead us to starting to make moves towards having like an immunity passport, etc., to try and reopen the country. However, they do not tell us quite a few other things, and it's easy if the test is rushed out to have many mistakes in this test, which can lead to people either having had the virus without knowing, or not even having the virus but believing they've had the virus. And that could open up all kinds of wormholes. So there are issues, but we will get a coronavirus antibody test sometimes, and it's a start. But I think people need to be aware of the risk, which I've outlined in this video, because it's not the perfect solution, but it's somewhere. It's getting somewhere. Stay tuned for more videos from Biology Explained. Thank you.